Disadvantages of the surgical therapy or the disadvantage of these methods are it cannot show the presence of periodontal ligament between bone and tooth surface indicative of new attachment. It will not show the presence of periodontal ligament between the bone and the tooth surface indicative of new attachment. We cannot calculate new attachment through only probing measurements. For this, we need recent advances of periodontal measuring machines, okay, through which we can go for checking of the active periodontal state of the disease as well as the new attachment formation. So with the help of only Williams periodontal probe and radiographs, we cannot determine properly the periodontal ligament between the bone and the tooth surface. Histological procedure, we can see, we can go for certain kind of stains and dyeing methods through which we can go for histological procedures, which is the most accurate one. Because in this diagram, you can see development of PDL is there, okay, new cells are there, bone is there. So these, with the help of staining materials, we can go for proper investigation of the newly formed tissues. It can be either periodontal ligament, bone, or alveolar bone or cementum. Okay. Now, basically, whenever there is a concept of regeneration, we come to the Melcher's concept. This Melcher was the person who has given the concept for the cell population. Okay, it was given in 1976. So basically, whenever there is a regenerative therapy, Melcher concept is a main thing. So basically, it includes the epithelial cells, cells derived from the connective tissue, cells derived from the alveolar bone, and cells derived from the periodontal ligament, which are potential of having the regenerative capacity. And regenerative capacity was admired by Nyman et al. In 1982 and Warrior by 1993. Now, cells and the molecular basis of the periodontal regeneration. So basically, there are various kinds of cells which helps in the development of the regeneration. So basically, the regenerative cells are fibroblast, osteoblast, and cementoblast. And molecules are also there. These molecules are your cytokines, interleukin 1, 4, 6, 8, 10, TNF alpha, growth factors, fibroblast, growth factor 1, 2, BMPs, PDGF, adhesion molecules, collagen, cementum attachment proteins, and certain kind of structural proteins which are proteoglycans, hyaluronic acid, osteocalcin, osteonectin, tenacin, and certain kind of non-collagenous